How medicine should bridge the gap between neurobiology and subjective experience in psychedelics. My name is Aidan Kunju, and I'm from San Francisco, California. I'm currently a medical student at the University of Miami's Miller School of Medicine, and I'm interested in neuroscience, arts, and the humanities. And how I became interested in this topic, bridging neuroscience and subjective experiences in psychedelics, is through my humanities courses. Actually, in undergrad, I took a course on the indigenous use of various herbal and plant medicines, one of which was psychedelic substances. And it made me interested in the way that the current Western medical model and research is conducted in contrast to the way that psychedelics were traditionally used in a lot of historical indigenous societies. So in this talk, my thesis is to make the point that an understanding of both neurobiology and subjective experiences responsible for psychedelic therapeutic effects should guide biomedical research and development, and historically indigenous medicinal use should be considered to contrast the Western medical standard. So in the research of psychedelics, there are kind of two perspectives, two ways of looking at things. The first being the microscopic perspective. So this deals a lot with the neurobiological mechanisms, just like going in really small, looking at the chemicals that are involved in the brain, where are they binding in the cells and the neurons? What downstream effects do those little chemicals have on the cells, and how that impacts the rest of the pathways involved in cell signaling. And this is often really a focus in terms of pharmaceuticals, because the goal of a lot of pharmaceuticals is to mimic these little molecules or understand how they're working so they can manipulate those pathways. The other way of looking at things is just take a step back, forget about the little chemicals and what they're doing in the brain, and just what are you actually feeling when you take um, something like psilocybin or LSD? What is your subjective experience? How does that change the way that you're thinking, that you're feeling? What are you seeing? And how does that impact you going forward? So that's the macroscopic perspective. So I want to attempt to bridge those in this talk, especially for the realm of biomedical research. So I wanted to just give a brief overview of neurobiology first. And these are just highlighting quickly some of the main findings or things that they talk about a lot when they talk about the specific microscopic, the mechanisms involved. The first of which is the 5-HT2A receptor, which is a receptor for serotonin, one of the chemicals in the brain. And psychedelics activate this receptor as well, in addition to serotonin. And this plays a role in how they cause hallucinations, but also downstream effects on neuroplasticity, which is the ability for neurons, brain cells, to be able to grow new connections and rearrange themselves, essentially. Another one that you'll hear a lot in the literature is brain-derived neurotrophic factor, BDNF, which is another chemical that is also involved in the action of a lot of antidepressants, which also impact neuroplasticity. And so this just plays downstream effects on other chemicals, one of which is mTOR, which is a protein that also regulates cell growth, proliferation, and survival. So it makes sense that something that regulates cell growth and proliferation would be involved in neuroplasticity, which is the process of forming new connections in the brain in neurons. And so mTOR is also activated by BDNF, and So again, the downstream effect is increased synapse formation between neurons. And synapses are basically just like the little gaps in between brain cells, the place where they transmit information to each other. So going off of this neurobiology, a lot of pharmaceutical companies work off of this, or research works off of this. And the end goal of many, not all, but many modern drug development efforts is to utilize these neurobiological mechanisms, and in doing so, develop drugs and treatments that maximize therapeutic impacts on mood, neuroplasticity, while mitigating undesirable effects. So they want to utilize these microscopic mechanisms and reap the benefits of those processes, but they want to avoid the undesirable effects. They want just, a pill that you take and maybe you don't feel anything, just besides that your mood improves, your depression improves, the PTSD is easier to treat, something like that. So when we talk about undesirable effects, what are we really talking about? From the Western medical perspective, this includes things like nausea and vomiting, hallucinations, ego dissolution, which I'll talk more about, and altered consciousness. So, just looking at these, you can see something like hallucinations, altered consciousness. These are things that we classically just uh, associate with psychedelics. But in a lot of research efforts, especially when you look at something like microdosing or research into microdosing, they want to avoid as much as they can something like ego dissolution or nausea and vomiting. There's a very clear binary between what's seen as a good effect of taking a drug and a bad effect of taking a drug. But let's step back. When we kind of make this division between the good and bad effects of a chemical, are we missing anything? So I want to talk about the indigenous perspective. And I want to give an example of the Mazatec ethnic group, which is a group that is located in Oaxaca, Mexico. And they, in their culture, use psilocybin mushrooms in healing rituals, which are known as veladas. And um, vomiting after ingestion is considered part of the ritual. So people will come for various ailments, whether it's a mood thing or a physical ailment. And one of the traditional medicines they use are these mushrooms. And vomiting is seen as a part of the process. It's not seen as a bad effect. And oftentimes it's actually taken as a measure of whether the therapy, whether the treatment was successful or not. So they don't see it as something unpleasant to be avoided, but actually they see it as like a purging or ridding the body of its impurities through vomiting. And it's just interesting to think about this when we compare it to Western research and therapy protocols, which often, if you read the literature, will say things like these are the steps that we take to avoid vomiting in the patients. Um, and so many might argue, just looking at nausea and vomiting as an example, many may argue that um, that these protocols strip the patient of an important metaphorical and a somatic component of treatment. So are we missing out on something when we apply this strict binary of good and bad to something like psychedelics, ignoring the subjectivity of how you feel? What if you feel like you're purging something bad when you're vomiting? So let's delve a little deeper. What happens when we break free and look into the subjective aspects of psychedelics, which may have been previously disregarded as undesirable side effects? So I'm going to talk about altered consciousness and ego dissolution really quick. So let's talk about altered consciousness. What's really going on when someone has an altered state of consciousness, when they're thinking differently after ingesting a psychedelic substance? And one model that's used to understand this is called the default mode network. So it's a little complicated, but you can basically think about it as a network of brain activity that is active during rest and during self-referential thoughts. So this is what's active when you're thinking about yourself. And you can see how that's very applicable to psychedelic therapy. It's very introspective, thinking about yourself and your own thoughts. So the idea is that psychedelics disrupt the default mode network's resting state connectivity, and this disruption, in a sense, can reboot these inward focused thought patterns. And the DMN disruption may also be involved in the ego dissolution, which I'll talk about, which is the loss of self-sense. So if you can see how this is kind of a way of understanding the way that psychedelics impact one subjectively during such an experience. And then I'll talk about ego dissolution, which is the losing of sense of self. It's often a mystical experience that's associated with psychedelics. And you can break ego dissolution down into two components, one of which is ego loss, which is the actual dissociation of yourself, the feeling of your mind and body being separated, or the feeling of your thoughts being separate from your concept of yourself. It's kind of a fracturing of your identity. And the other component of ego dissolution is unity. It's called unity, and what that refers to is the sense of belonging or connectedness that you feel with the people around you, with nature, with the universe, that a lot of people associate with psychedelic experiences. So you have ego dissolution broken down into ego loss and unity. And these are two subscales, ego loss and unity, that were developed as a part of the ego dissolution scale. So it's a 16-item scale that researchers recently have developed to measure ego dissolution. It was shown to have good reliability and validity, which is important for a scale in science, to be able to measure something. And ego dissolution, you can see it might be dangerous, but the reason why I'm bringing this up is because there also may be therapeutic potential for this in the future. And the only way that we can understand whether or not this is possible is through research into the subjective experience, like the research that led to the development of the EDS. So you can see how using the EDS and these efforts to study things that are maybe a little bit harder to quantify, but help us better understand the subjective experience, will give us a better understanding of how we can use these going forward. So like something like the EDS would ask things like how much did you feel a sense of union with others during the experience? Did you experience a disintegration of yourself or ego? These are just a few items on the EDS that have been validated. So what I want you to take from this is the conclusion, or it's a call to action for researchers and physicians to place greater emphasis on studying the subjective experiences involved in psychedelic therapy and to break free from the norms and expectations of the Western medical model. Of course, people must operate within the system that we have in place, but when we choose to study something, or when we choose the way that we study something, when we place an emphasis on studying the subjective aspects that may have been previously ignored or overlooked, we avoid just missing out on a huge component of the potential that psychedelic therapy has. So just for fun, imagine a future where we could integrate our knowledge of the default mode network and how subjective experiences actually happen, and those processes happen in the brain, combined with our knowledge of ego dissolution and the sense of unity that happens during a psychedelic experience, the belonging and sense of connectedness, the potential for psychedelics to reset rigid thought patterns, using things like research into ways of quantifying subjective experiences and our existing knowledge of neurobiology. What if we could, what if in the future a physician or a psychiatrist could prescribe something like ego dissolution? What if we understood ego dissolution to such a degree that we could control how much ego dissolution someone experiences? And what if we knew exactly how much ego dissolution someone needed to experience to reap a certain therapeutic benefit, to alleviate this degree of depression or anxiety? Um, it's it's not something that we're close to understanding right now, but we won't ever know if this is possible unless we put in the effort to study these things. So that's my point. Um, so that's all I have. Thank you so much for taking the time to listen. And I'm open to any questions. And I have my contact information and my social media. Um, Happy to engage with anyone who's interested or answer any questions. So thank you again for your time.